It's really easy to give up in this program. There's a lot of different problems that college and university students face, not only educationally but financially and with personal lives. But the biggest piece of advice is don't give up. You started nursing for a reason. You have a passion for it, and as hard as it might seem some days, you can get through it. There's help within your school, within your support systems. It's not impossible. It's something that if it's something you really want to do, set your mind to it and you can accomplish it.
I find that my biggest challenge is time management, especially finding time for myself.
Was pretty much being organized the first year, because I'm not saying I'm not an organized person, but just, you know, having a full course load and knowing that you need to do homework at this time and trying to organize your schedule around nursing was very difficult for me, because it was so, I didn't know how big nursing was.
The workload isn't unmanageable. However, you have to. I find that finding a nice schedule to give myself enough breaks in between all the homework and my social life, and I found that it's very important to maintain a social life with nursing, but it's also very difficult to do that, because if you spend too much time focusing on your social life, then you're not spending as much time on your homework. But if you're spending too much time on your homework, then you're not happy, and being miserable is not something that's fun.
Stress from the workload, and the first really big pointer I could ever give to any nursing student is to just realize that you have to kind of sift through the best of what you can do, because it's impossible to get everything done.
Now I'm like way better. I have a scheduled date on what homework should be done, what day. If I miss that date, then what day can be done on.
Well, another challenge I've faced is putting up with the sheer volume of women that are in this program. They tend to be very hormonal and it comes out, so just balancing the emotions that occur is a challenge, and how I've dealt with that is I help them rationalize, and I make sure I keep as many male contacts as I can, and I also took up wrestling as a method of output.
My biggest problem that I've encountered would be writing. I feel like the nursing program expects such a high level of writing, but it's not taught in high school. It's not taught in the pre-sciences program or in the nursing program itself. And depending on what school you attend, they might not have the proper resources to help you with that. But to overcome that, I've just been taking all the criticism that I can get and making sure that I've set aside extra time and making sure that I edit and edit and edit.
I was really bad at writing essays, and that was a huge challenge for me, because I come from pure French school, but to learn how to write essays in French and everything all in French, read in French, write in French, and from changing from a French school that I've been my whole life to a pure English school, that was a huge challenge for me, because writing an essay in the APA format was really hard. I had a really difficult time, and I didn't feel like I had the resources to do it in first year, but I didn't feel like I knew exactly how to do that. Now I feel like I'm better, but I still have some ways to go with my essays, and that was a big challenge for me, because essays is a big part of first year.
Another issue that I've encountered in nursing is taking the different aspects of the learning, so the clinical environment and the theoretical environment and the lab environment, and putting them all together instead of just letting them run as separate, discontinuous strains. I've dealt with that by looking in class and just brainstorming situations that could pop up in clinical, and also I did this in lab, and just relating how I would how I would respond in whatever situation. This was actually also really much bumped forward by using a simulation lab that helped me pull all my informational knowledge together in a classroom setting with a teacher where the patient couldn't die, I couldn't basically harm a patient.
Well, related to everything, I guess, was I didn't know how much stress I'd be under.
I don't know, I'd say it's a roller coaster, the nursing program. So you might be having a great day and get a paper back and just passed it or even failed it, and right then and there, like, quite honestly, I've gone home and ripped up a paper and thrown it out, and I have to. That's the only way that I could, let it out, like, because you spend so much time on papers, and if you don't get the mark that you feel like you put into it, a little piece of you just, is like, oh, why do I still want to do this? But at the end of the day, I know it's what I want to do. So even if it takes me 10 years to finish, it's going to take me 10 years. There's nothing else that I want to do.
But I take criticism so to heart, and I take criticism, grades, how I study, like, very serious, and I didn't know how much I would take it serious. And now that I'm in second year, I take everything so serious, and when it's something that I try my best at and I don't succeed, I get stressed, and it's not healthy for me to be stressed. So I just feel like that is a major thing. I didn't know how stressed I was going to be, and I'm stressed all the time. I don't deal well with it. I know how to deal with it. I know how I should be dealing with it, but do I have time to deal with it? No. I do all the wrong things. I do negative dealing. I eat a lot. I should be working out, but I don't. I know the benefits of working out and studying, but do I have time to work out? Because now that I'm worried about, my exams, it's, do I work out or do I study? So it doesn't help.
Finally, I think a challenge that I've faced is just managing all the finances in transit that have come with moving to a new city. So the first year was a really large challenge because I was getting to know the people in my classrooms, and I had clinical placements all over the city and I didn't have a vehicle. So it was developing very quickly people to carpool with all over the city at very early hours in the morning in the middle of January.